Welcome to Change in Condition, Communication, a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. The information contained in this module is relevant for nursing assistants who are on the front lines of providing care for patients, anyone providing care to an older adult in any caregiving capacity, and even those not in a caregiving capacity who are looking for ways to improve their knowledge and understanding of how to effectively communicate a change in a person's medical condition. Superior Health aims to empower you by increasing your confidence in communication skills, an important skill for the safety and well-being of patients experiencing a change in condition. The purpose of this course is to further your learning and application of these skills to real-life situations. This learning module, Change in Condition, is a 4-part series. You are viewing the second of the series, Change in Condition, Communication, which provides an overview of how to effectively communicate and work towards a patient-safe environment. This module has 3 additional sections in the series. The first part gives guidance on how to recognize a change in condition. The third part of the series demonstrates using various tools to communicate change, and the fourth is a review of a case study. It is not necessary to complete the entire series in one sitting. You can leave and return to the course at any time. Upon completion of this module, the learner will be able to describe how communication is an important part of working toward a safe environment, describe how to communicate about unwanted events, and describe the key steps to effective communication. Let's begin with a case study. Mrs. C is 85 years old. She has lived at the Manor Nursing Center for about 1 year. Lisa and Ann are the nursing assistants on duty on Mrs. C's unit today, on the evening shift, and Linda is the licensed nurse. Lisa and Ann know that Mrs. C has recently learned her daughter, who lives in another state, is seriously ill. After the evening meal, Lisa notices Mrs. C is not her normal self. Usually talkative, she is suddenly not talking much. She is also limping for an unknown reason and seems very upset and angry. Lisa tries to talk to Mrs. C, but doesn't get much of a response. When she arrives to help Mrs. C prepare for bed, she finds Mrs. C already asleep on her bed, still in her clothes. When she wakes Mrs. C up to help her get changed and washed up before bed, Mrs. C seems disoriented and says something rude to her. What needs to be communicated? And to who, by whom? How? When? Where? How do you know when the communication has worked? In answering these questions, think about specific things that specific people should do. What should Lisa do next? What can Ann do? What can Linda, the nurse, do? Should Linda call Mrs. C's attending doctor? What should they tell the night shift licensed nurse and the nursing assistant when they come on duty? Detecting and reporting changes in a patient's condition are the centerpiece of high-quality care, and they are key to making sure patients are as well as they can be. In your work, you probably notice changes in, for example, a patient's behavior or ability to do certain things. This is very important. Often, changes can be detected just because you notice something out of the ordinary. The next important step is knowing how and when to report such changes. Reporting changes is necessary for quality patient care, and that means working with others. Using your skills to communicate changes across the care team may be the most important thing you can do for your patients. Learning to effectively communicate changes in a patient's condition also depends on the care team working well together. So being a good team member and helping others to be good team members are also important when it comes to good communication. When team communication is poor, people often say they do not feel they are heard. especially by their supervisors. So pay attention to them if there are people who report to you. Make sure you are listening and they are heard and feel heard. Good communication skills help team members work together toward the goals they share for good patient care. And this is how things get done. Communication teaches team members how to come to agreement and how to achieve a common goal. Team communication has to occur from the leader of the team to all team members and also among all team members. Research shows that teams with better communication provide better care. Observing and reporting changes helps keep residents as safe as possible. Residents are most safe, protected from harm or injury, when it is normal and accepted that care providers openly report anything that might affect a patient. Sometimes people worry about reporting a change because they feel something has gone wrong and they wish it was not so. But you must report the change since the patient cannot be helped if no one knows there might be a problem. Learning and experience are what makes safety possible. This involves practice and time on seeing and observing how things work, noticing when they are not working right, and understanding how to prevent unwanted outcomes from happening again. Lastly, experience teaches us how to recover from unattended outcomes and events. A safe environment exists when people openly report anything that might affect a patient's well-being and feel supported when doing so. An experienced care team has seen sick people get well with good care. They have also seen things go wrong in the care system. Team members have learned how to avoid those situations. However, when situations cannot be avoided, they fix them as well as they can. But they can only do so if they have the information that comes from reporting. You can help everyone work toward having a safe environment by reporting resident change openly whenever it happens. One of the most important ways experienced care team members have learned to improve safety is by learning to communicate openly with each other when something happens. This may not be easy. When things go wrong or look as if they nearly did, we tend to feel embarrassed and worry that if we report the problem, our job performance could be questioned, or we might be punished. And we don't want to get anyone else in trouble. This is particularly true if a supervisor needs to be involved. As a result, things that might affect a resident's safety may go unreported or not be discussed. Not being able to talk about how things did or could go wrong holds back our own learning. Learning is much harder if we can't see what happens when things go wrong for others, or if we can't get feedback when it happens to us. Everyone, residents and staff, benefits from an environment that supports discussion and learning from unwanted events that happened or nearly happened. We all care about the residents in our nursing center. To make sure they stay safe, we have to move beyond blaming anyone to being able to openly share experiences, good and bad. It is true you may come across a situation in which a care provider's actions are not well intended. That person may have to be identified and possibly removed from the setting. But it is very unusual. Usually when things do go wrong, it is because a provider was too tired, or was distracted, didn't know the system, or the teamwork was not smooth. Sometimes systems create an accident waiting to happen. These kinds of problems can be fixed best if discussed and encouraged to be discussed, and the care team can work together to figure out the solution. Caring means speaking up. Residents expect and deserve a safe environment, but often cannot speak for themselves. So it is up to the members of the care team to speak for them. While that's easier for some of us to do than for others, especially on sensitive matters that we think might cause blame. It is something we have to learn to do. It helps to have tips and tools for speaking up. In particular, it helps to be familiar with what information you need to share with the rest of the team, who you need to share the information with, and how to best communicate with that person or those people. What is communication? It helps to think about it in 3 parts. Communication consists of a giver, a message, and a receiver. Communicating well involves expressing yourself, the sender, in a way that you will be heard or understood by other people. Hearing how other people, the receivers, answer. Really listening will let you know if you have gotten your message across. One kind of communication is verbal. Verbal communication involves speaking and listening to speech. With verbal communication, things can sometimes get in the way of your message. Certain words may mean one thing to you and something else to another person. Sometimes one person uses jargon or words that are specific to what they do that other people may not know. How quickly we speak or what kind of accent we have can also affect how other persons receive what we say. A second kind of communication is nonverbal. This has to do with our facial expression, how we move our hands, if we look the other person in the eye, how close we stand to the other person, etc. This kind of communication can either help get a verbal message across, or it can get in the way. Who is responsible for communicating change in a resident's condition? We all are. Good communication is part of a safe environment. Good communication is a skill you can learn. There are 3 stages for giving information. Get ready. What information do you want to give and to whom? Is it an emergency? Is it urgent? Or routine? Give your information. Keep it short, clear, and to the point. Sometimes, depending on how the other person seems to be receiving it, you may have to change your presentation while it is happening, or repeat it in a different way. Check to see if it worked. Follow up to make sure your message is understood. There are also 3 stages for receiving communication. Listening. Focus on the person you are listening to. Let him or her know you are paying attention. You may want to ask questions to be sure you understood correctly. Responding. It can be helpful to repeat, in different words, what the other person said to you to show them you understood. Think about how to give information back to that person in a give and take until you both are sure you heard it right. Following up. The next step is being clear about what will happen after the message is given and received. What do you need to do or need the other person to do? How soon? Does everyone agree on the plan? Sometimes communication may not go well or may break down completely. What gets in the way of good communication? People may be afraid to speak up. They may not know who should be getting the information. They may be shy or find it hard to communicate when they are under stress or talking with a superior. They may worry that the receiver does not think that what they have to say is important. We all have different ways of communicating. It is important to understand how differences can become barriers that keep our message from getting through. Gender differences. Many people believe there are differences between men and women in the way they communicate. Generational differences. Our age, or the generation we grew up with, also influences our communication. This is because language changes over time, and each generation may use different words to say the same thing. New words come into general usage, while others fall by the wayside and may even become unacceptable as time goes by. Language differences. This can be about speaking in different languages such as English or Spanish, or using jargon. When people are not speaking in their first language, it can be hard to communicate. Jargon can also be a barrier, since it is not always understood by the listener. Cultural differences. These can be our beliefs about other groups of people, our values, or what we think is acceptable or unacceptable behavior. Getting to know how our coworkers communicate in their own way, how they talk, what they feel uncomfortable saying, is important because it can be difficult to achieve. Status differences. When licensed nurses and doctors are valued as equal professionals, communication is better. But when licensed nurses are seen as people who take orders from doctors, communication is more difficult. The same holds true for communication between nursing assistants and licensed nurses. Interpersonal issues. Sometimes team members have differences that have led to negative feelings between them, and they may prefer to avoid communicating with each other. When this happens, communication about the patient care issues may be compromised. Environmental or system barriers. The very detailed process through which licensed nurses and doctors communicate needs more attention. In long-term nursing centers, many of these exchanges take place over the phone, complicating things even more. Workload issues. If you or another member of the team are overwhelmed with work, it may be hard for you to find the mental energy necessary to communicate well. You may feel that you can't spare the time to follow good communication practices. Sometimes we face several communication barriers at the same time. For example, two groups of professionals who often face communication difficulties are licensed nurses and doctors. While all the barriers listed above may be involved, those related to status and systems are most likely to come into play at the same time. In summary, early recognition of changes in a patient condition is essential to their safety and well-being. Appropriate action can't be taken if team members notice the changes but are not able to communicate about them. For good communication, be aware of and have ideas about how to work around the barriers. Give clear messages. Focus your attention on what the other person says by actively listening. Be aware of nonverbal signals, both given and received. Give and ask for feedback. This makes a positive outcome for the patient more likely and can improve future communication. It is now time to test your knowledge. Click the link for Changes in Condition Communication quiz on the Frontline Forces webpage or in the YouTube description below. This material was prepared by the Superior Health Quality Alliance.